Compliance to these new measures by Nigerians will be very important in the days ahead. But what does this mean in terms of public health generally? I'm being joined now by a public health physician, Dr. Adekemi Kiladejo. Thank you for your time. Thank you for coming in.
Yeah, thank you for having me here.
What do you make of this phase two of the eased lockdown, particularly the explanation of the various guidelines, while some are being eased, some are remaining banned? Overall, what's your impression?
Yeah, so I think that the presidential task force have come together to find a way to strike a balance. We cannot lock the economy for too long. Suffice to say that at every point in time, every decision we take must be evidence-based. What is the evidence that locking the economy, locking everywhere, having continuous lockdown will add some gain with community transmission? At the state of containment, which we have long passed, we could say, let's have lockdown, people shouldn't move around. But at this stage, we're having a lot of community transmission. And when we're doing that, we have to continue to pass out the messages on prevention, on risk communication and all of that. Wash your hands, social distancing, maintaining personal and hand hygiene and respiratory hygiene, putting on the face mask and all of that. But what is happening at this phase is that we're trying to reopen the economy gradually. And I think that the first 2 weeks was to prepare various facets of the economy, to get all the preventive measures in place, to have precautions in place, so that when the lockdown is fully eased, they can have reduced transmission of the diseases. So I expect that at this point in time, even the banks that are operating fully, the hotels, and every other part of the economy that is operating fully should have facilities to ensure things in place for social distancing, measures in place for social distancing. They should have water, soap everywhere in their organizations. At this point in time, we shouldn't be talking about get sanitizers everywhere. There should be thermometers to check temperature, so that if there's anyone that is febrile, you could do some further checks for the person and isolate the person from the other staffs. Organizations should have gotten face masks available for their staff. And so at this point in time, I think it's time for Nigerians to begin to talk about taking responsibility, while the government is also doing their best. And all other stakeholders, not only the government, there are so many other stakeholders that are involved in this fight. The healthcare workers, the community leaders, they're all involved. Civil society organizations are involved. And so as we work together, it is important that at this phase, every of these facets take responsibility. And so that's what I can see from that.
Now, those who will be listening to you, some will have it at the background that just over the weekend, we had the highest number of confirmed cases for a single day. Yeah. And that scared some people. Yeah. And now we're moving into phase two. Yeah. In phase one, compliance was an issue. The various issues you raised, face masks wearing, social distancing, and then now more and more places are going to open. Yeah. You also pointed out that we've left containment.
Absolutely.
A long time ago.
Yeah, absolutely.
And that community transmission is going on. Don't you harbor any fears that as we open more and more of these places, given the issues we have had with compliance, we might be taking a fairly big gamble?
Okay, so this is what I would ask. The way I will answer your question is by asking, what do we stand to gain when we keep locking down? That's the question.
Okay.
We've had easing of the lockdown in the last 2 weeks, but despite that, cases are increasing, right?
Right.
So it has gotten to a point where evidence-based, science-based, we can see that even having the lockdown is no more achieving the results that we want. And at every point in time, we have to be concerned about the good of the people. So we can't keep doing things because everybody is saying let's lock down, or some communities are still locking down. But I want us to know that even though the federal government is saying let's ease the lockdown, states also, state governments, I remember the presidential task force emphasized that state governments have to take responsibility.
Yes.
And so at every point in time, if you think there's a reason to lock down a particular community to prevent spread, why not? But we can't lock down the whole economy because there must be a balance between the public health preventive measures we're taking and the economic problem, the economy.
Yes.
At some point, if we're not careful, we'll start dealing with so much of insecurity and malnutrition amongst children, so many issues of such nature. So what do we do at this point? I think we need to keep ruling out the preventive measures. We need to keep spreading the information. Avoid touching your faces without properly washed hands.
Right.
Wash your hands with soap and water, with soap under running water for about 20 seconds. Keep a social distance of at least 2 meters apart. If you're not sure what 2 meters is, stretch your hands and let the other person stretch his hands without touching. I mean, you don't have to carry a tape measure up and down to get the 2 meters, but it's that easy. And like I said the last time I came here, community engagement is key. And one of the things I'm happy about was the last time, the briefing before today's briefing, I think that should be on Friday. I listened and I knew that there were strategies that the Presidential Task Force was planning to roll out for better community engagement. But one thing, it's important to plan very well, but one thing is planning, another thing is implementation, and the third part is evaluation.
Right, that's after you've implemented.
After you have implemented. And so all of these have to go pari passu. Having excellent plans are key, but the strategies for implementation of all of these plans have to be carefully looked into so that we can get the valued result. And at different phases, we must evaluate every measure we're putting in place so that we will know if we need to review. And is it going to is it improving our output? Is it going to improve the outcome and the impact in general on the Nigerian society? Those are things we need to keep taking into cognizance at every point in time.
Something else that would worry a number of people would be that the more you open up, of course, the more the chances are there will be more infections. And that brings the capacity of the medical system in terms of both personnel and facilities.
Yeah.
Already, we were being told before we moved to this phase that we need to tinker with the whole idea of everybody come to isolation once you're positive because the bed spaces were not enough. And then you have issues with the medical personnel like yourselves being overwhelmed in many places.
Absolutely.
At this point in time, given this phase now, do you see any situation where it is possible that even if we were to get more infections, the health system as it is now can cope?
I will answer your question by saying we need to think out of the box. There is already a lot of pressure on the health system, and I think the COVID-19 era is an opportunity for us to look into the health system and look at how we can improve on the health care system in totality. But at this point in time, looking at COVID-19, what can we do at such a time like this? Some of the measures that we can take is looking at the option of home isolation. Not everybody with COVID-19, not everybody that has tested positive for COVID-19 is symptomatic. So we have a group that are asymptomatic. Yes, they can still keep infecting people, but they have no symptoms.
Very dangerous group. Actually.
Yeah, very dangerous group because they walk around thinking all is well and they might even not want to put on their face mask and all that. And that's the importance of testing. So you test and you realize they're positive. They need some form of isolation because they can still spread infection, especially amongst their families and the people they interact with daily. So what do they do? When we have home isolation, what we're saying is that those that are asymptomatic and those that are mildly symptomatic. I mean, mild symptoms, mild to moderate symptoms, leaving the available structures in the health facilities for those that are severely ill and those that are compromised in some sorts. And then while we're saying home isolation also, I'm sure the high risk, the very high risk group, like the those that have some form of comorbidities, underlying health, or the elderly. The people in that group, of course, we can't isolate them at home. And when we're talking about home isolation, it has to be properly done. We have to do a bottom-up approach. And so we work from the communities, and then we allow the primary health care system to be in touch, communities to be in touch, to plan this. They have to be engaged. I'm not talking about informing the community on what we want to do, but the highest form of community engagement, there has to be community ownership, not just involvement or participation. They have to own it. They have to understand why people need to be isolated at home so that they don't stand a chance to be stigmatized again. And that's why we need to carry the community along. And being isolating, having someone isolated at home, what does it really mean? It means that for some people, they have space in their house where they can keep to themselves and just have somebody do their groceries, pass food to them with minimal relationship with other people in the house physically. I mean, they can call, they can have video calls and all of that. But that cannot be done everywhere because we do not have a homogeneous society. We have societies where we have 5, 6, 7 people in a room. And so in that case, and what if that person is asymptomatic? Do we say home isolate? Absolutely not. At some point, we might have to take them out, or we do what we call reverse isolation. Reverse isolation means you could take the elderly or the high-risk group out of that place. So that
even though they are not the ones who are affected.
Yes, they are not the ones who are affected. But you know, if they contact the virus, they are more likely to degenerate with their with what they come up with their health conditions and all that. And then I think this home isolation doesn't mean that those people at home will be abandoned. They're going to be having real-time communication with the healthcare providers, either through calls or through various exams. At any point in time, when the asymptomatic becomes symptomatic, or the mild to moderately symptomatic becomes severely symptomatic, of course, it's just a call across. And then we can come and evacuate them to the isolation center, for proper monitoring. I think that will help a lot to decongest the existing facilities.
A lot of food for thought.
Yeah.
Thank you so much for your time. Thank you for coming in.
Yeah, thank you for having me. Nice to be here once again.